What's next in global events? Third World War? The Rapture? A revival? The Great Tribulation? The body of Christ has been misinformed and misled for so long by the cunning craftiness of deceitful plotting. Once we understand God's eternal purpose for the earth and humanity, and then his pattern, principles, and plans, we will have an understanding about why things are going the way they are in the world. Enroll today for the next Move of God course from the Kingdom University to find out and prepare for what is coming. With the enrollment, you will receive PDF versions of the 2 latest books by Abraham John, The Birthing of a Kingdom Nation, and What Happened to God. The online course starts on October 17th, 2024. To enroll, please visit www.thekingdomuniversity.org.
Good morning. How are you? Good afternoon, good evening, depending on what time you're watching broadcast, Mamlakak Broadcast Network. Welcome back to another health bulletin. Remember what I always tell you, that it's very important for us to learn how to take care of our bodies, because if we don't know how to take care of our bodies, we're not going to have the body that we need in order for us to fulfill the purpose that God has for our life. So it's very, very important for us to make sure that we take care of our body. That's why in Mamlakak Broadcast Network, we got this health bulletin to inform you, because how are you going to take care of your body if you don't know how your body works and you don't know what the things that are good for your body or not, or what you're supposed to do or not? Okay, since that is not taught in everyday school or in everyday life, that's why we are here in Mamlakak Broadcast Network, have the health bulletin to help you with that. So today we have what it might be like a little controversy, but it's a trend. I don't know if whatever you are right now, if you are watching the TV, you're going to see commercials about this. If you are in social media, you're going to find commercials about that. If you're going to be, if you're in the internet, in Google, you're going to be ads. You're going to see ads about it everywhere. It's about GLP-1. It's a class of drugs that they're using now for weight loss. It was originally intended to be made for diabetes, type 2 diabetes, but now they find out that it helps with weight loss as well, and now they're making it for weight loss. But now that medication is in the mouth of everybody. There's a lot of people going to the doctor and requesting this medication. Even people that really don't need the medication are requesting the medication. And then we have the doctors that even offering the medication to people that really don't need the medication. And of course, we have Big Pharma making all the money. They're making billions right now. They already have made billions of money when it comes to this medication. And this medication is not cheap. But they call it now in the drug, in the healthcare field, they call it a panacea. What is a panacea? A panacea is a medication or the herb that can cure everything. Well, in my 30-something years that I've been in the healthcare field, I only heard the word panacea to describe an herb like moringa or like noni, for example, or mushrooms like reishi and cordyceps and shiitake. Those kind of foods or natural foods were called panacea because they were good for so many things. But this is the first time in my 30-something year career that I hear a drug be labeled or talk about, as a panacea drug. And I was like, this needs to be church because this research, because this feels too good to be true. Before anything, I want to say hello to Ambassador Victoria, hello to Ambassador Veronique, hello to Mr. Ambassador Brian Lawson. Thank you, all of you, for being here. So let's start. Can the producer put the first slide, please? So as you can see, the GLP-1 is a class of medication, like I told you before, that they are using for diabetes. They start using for diabetes, but now they're using for weight loss. There are about 7 different ones, but these are the most common ones. The most common ones are Ozempic, Wegovy, and Mounjaro. Those are the most common ones. Okay, it's an injectable that the people that need it use it once a week. They use it once a week. They inject it in either their tummy, they can inject it in the hip, they can inject it in, behind the arm once a week. Okay, so let's go to the next. Let's explain first what is GLP-1, because GLP-1 is a hormone that our body makes, okay? Something that God put in our body already. So what does the GLP hormone do? The GLP hormone is secreted by the small intestine, okay, and it has several roles. The first thing it does is it trigger insulin release from the pancreas. So as soon as you eat something, the intestine and the intestine start receiving the food, it let them know that you need to secrete GLP-1 because I need to tell the pancreas that it needs to secrete the insulin so the insulin can take that sugar back to the muscles where it needs to go. The next thing they do is block the glucagon. What is the glucagon? The glucagon is the stored sugar that is in the muscles. Okay, so it said, do not release it because sugar is coming. Okay, sugar is coming. You don't need to release anymore and increase the blood sugar. Don't do that, please. Sugar is coming over already. I already told the insulin to secrete, and they do that job. And then the next thing they do is slow the stomach emptying. So that you don't receive a sharp raise on your blood sugar. Okay, what it does is that let your stomach release the sugar in the food slowly. Okay, very slowly. So a slow empty of the stomach happens. And then when that happens, there's a communication between your gut and your brain that tells your brain, hey, brain, this person is already satisfied. You know, they don't need to eat no more. Don't give no more food. All this happen. And then there is a hormone called DPP that is the one that breaks down the excess of GLP in the abdomen when it's ready to, that they don't need more. And that's the process that the GLP does. So yes, the GLP is a hormone that the body uses, okay, and that is created by God and it has a function that benefits us in many ways, okay. So let's go to the next slide. What other functions have the GLP-1? The GLP-1 is also produced in the brain, okay, and it has critical roles. It have a neuroprotecting role, protection role. It activates the GLP receptor signaling pathway. GLP-1 enhances the learning and memory in the hippocampus, promotes neurogenesis, that means creation of new neurons, neurological cells, okay, decrease inflammation and apoptosis, and apoptosis modulate rewards behavior, and reduce food intake. So it does a lot of things also in the brain, and in the brain there's some GLP produced there as well. So GLP have a lot of good production. Okay, so what happened, or what can cause a GLP deficiency? Why do you think people need deficiency, need the GLP-1? I mean, people think, or people are acting right now like everybody need a GLP-1. They think that the reason why we're fat is because we need GLP-1, but that's not it. That's not the cause of obesity. Okay, it's not a deficiency in Ozempic, but that's the way that they treating it. So what can cause a GLP deficiency or low production of GLP? So as we age, we make less and less and less. After 30, we start making less and less of the GLP-1. Also, GLP-1 secretion patients with type 2 diabetes, they've already been diagnosed with type 2 diabetes, and also the ones that have a non-alcoholic fatty liver or alcoholic fatty liver, they also have a lesser production of the GLP-1. Also, deficiency can arise during weight loss efforts due to change in dietary intake. You see, there are certain foods that activate the release of the GLP-1 and are foods that are rich in fiber. Okay, they're the ones that release the release. You know, carbohydrates are rich in fiber are the one that release the secretion of the GLP-1. So if you're in a diet, for example, that's before you decide to take any GLP medication or anything like that. If you're in a diet like a keto, that you're not having any fiber whatsoever, okay, then you're going to diminish the production of GLP-1 as well. And then sugary foods and beverages like juices and sodas, alcohol, refined carbohydrates, all of those like pasta and bread, it all reduce the effectiveness of GLP-1. So every time, that's why, you know, I don't know if you ever heard any nutritionist or any health coach ever tell you that when you change to so many diets, instead of just adopting a healthy lifestyle, but you go to all the different fat diets, you are damaging your metabolism because you're damaging the balance of the hormones that have to do with hunger and satiety. You damage that, and then that's why it's hard for you to, you know, keep the weight loss that you get once you stop a diet. So that's very important. So let's go to the next. So what do the or how do the GLP-1 antagonists, those are the medications like the Ozempic and the Wegovy and the Mounjaro mix, how they work. They work the same way, mimicking what God already created inside of us, okay? So the GLP-1 is like a synthetic type of the GLP-1 that do exactly the same, mimicking the hormone in medication terms. An antagonist is a manufactured substance that attaches to the cell receptor and causes the same action as the natural occurring substance. In other words, GLP-1 medication bind to the GLP-1 receptor to trigger the effects or roles of the GLP-1 hormone. The higher the dose of the GLP-1 antagonist, the more extreme effects. If you have type 2 diabetes, the medication helps manage your blood sugar by triggering your pancreas to release more insulin. The slow digestion also helps decrease blood sugar spikes. The side effect of GLP-1 agonists reduce your food intake, appetite, hunger. These combined effects also result in weight loss. So it works almost practically the same as the natural GLP-1, but it's not natural. It's made out of chemicals, okay? It's just a synthetic form of the hormone. That, because it's a synthetic form of the hormones and it have other ingredients, can be causing other things in our body, okay? So let's go to the next one. Now, the thing is that they always tell us how wonderful this medication is and all the things that it does. And the thing is that people are not going to lie. It does work. It does work. You will lose the weight. And if you doing it right, your sugar is going to be controlled. Okay? It does work. But let me tell you what are the benefits, and then we're going to talk about everything else. So what are the benefits? In addition to lowering your blood sugar and reducing your weight, that usually reduce anywhere from 15 to 20% of your body weight, which is a good thing. If you are 200 pounds, you can lose 20 in 90 days, you can lose 20 pounds. That's pretty good. That's a pretty good weight loss. And of course, you know that a lot of the diseases, a lot of the chronic diseases that we suffer nowadays are consequences of our diet, are consequences of obesity. Or either if you already had it, the obesity make it worse. So of course, by reducing obesity, you're going to reduce your risk of many of the common chronic diseases. You're also going to be lowering your blood pressure. You're going to be improving your lipids, your cholesterol, and your triglycerides. Because of course, not only you losing your weight, but this medication is going to make you eat a lot less. So you're eating a lot less. Even if you eat the wrong thing, you're going to be eating a lot less fat, a lot of less sugar. So it's going to lower your cholesterol and your triglycerides. It's going to lower your blood pressure. It's going to improve your fatty liver disease. It will reduce your risk of heart disease and kidney disease. Why? Because it's reducing your fat, it's reducing your sugar. Okay? And sugar and high blood pressure are the main reason why we get kidney disease. Okay? Those are the main reasons why people get kidney disease. Either because of uncontrolled high blood pressure or uncontrolled blood sugar. And now that you're going to have it under control and you're also going to lower your weight, of course, you're going to lower the risk of fatty liver, heart disease. It's going to be delaying the progression of diabetes and diabetes neuropathy. You know, that numbness that people feel and nerve pain that they feel in their legs and feet and their limbs when they are diabetic. That's going to lower the progression of that disease. Okay? And also lower the progression of you getting diabetes. That's why a lot of people that are pre-diabetes, they like to get into this type of medication to prevent getting diabetes. Okay? It also is going to help you for those that are very obese and are debating whether they're going to get a bariatric surgery that has so many side effects, okay, and quite a risk of dying in the table. Then I'd rather take the GLP-1 antagonist medication and don't have to put up with that, and on all the side effects, not to put up with all the recovering from a surgery and a major surgery and not being able to do this and that and having bad protein absorption because they cut half of your tummy and all that good stuff. So that's another benefit of the GLP-1 antagonist medication. Another thing is that reduce your food intake and also reduce your cravings. It's like kind of quiet down the thinking over and over and over about your food. That's because it stopped the thinking, then it stopped the craving. Another benefit that I forgot to add there that they find out and they still doing studies on it is that they notice that people that take the GLP-1 antagonist medications, okay, and they were alcoholic, for example, or they have an addiction like a drug addiction with cocaine or heroin or crack, all those things like that, they tend to lose their desire, or that they're smoking, for example, they lose their desire of wanting that particular addiction, of drinking more, because now they want less. And that anything that will add calories to your body, the body don't want it, because now you're reducing the appetite and reducing increasing the satiety in your body. So you don't want any food. The mind part of it don't want anything of the things that used to want before. There was an example in the study that they made that this particular guy used to eat at a Kentucky Fried Chicken. He used to be able to sit down and eat a whole bucket of Kentucky Fried Chicken. He was an emotional eater. One day he was a little sad. He wasn't feeling good, and he was already taking the Ozempic. He decided, I'm gonna go back to the Kentucky. I'm gonna buy myself. I'm going to buy myself the bucket. And he went to eat only 2 bites of one piece of the chicken, and he couldn't eat no more. So that addiction that he had for the Kentucky Fried Chicken food was able to be controlled. So they're doing more studies about that, but they're finding that that's something common that is happening with this type of medication. Okay, so now, those are all the good things, and those are good things, because it does work. It does reduce the amount of chronic disease. It does have a lot of benefits. But what is the cost of you having those benefits? What are the costs? Because it's too good to be true. Not everything can be all roses and nothing happen and everything's going to be fine. What is the cost for you to have this kind of benefits? How much it's going to cost you? And I'm not talking just the money. What's going to cost to your health? Because that when we do things when you use things that are not natural and you're adding other chemicals into your body, there is always a side effect. There's all the things that can happen to the body that we have to count on. So we need to count on those things to decide in a balance, what we want to do. Okay, what you want to do? You want to try and go to the risk and side effects, or you want to go the natural way of doing things? That's something that is very, very, very important. Okay, so let's go to the next one. The next one, please. Okay, what are the most common side effects? The most common side effects, and they say that the studies almost 50% of the people that start the Ozempic, for example, they get this symptoms. Most of them, they go, after a few weeks of taking it, but they get the symptoms. The most common side effects for the GLP are the loss of appetite, which is one that you want to have, the nausea, the vomiting, the diarrhea, the constipation, temporary itching and redness in the site where you put the injection, dizziness, mild tachycardia, that's when your heartbeat is racing, okay, infections, headache, and indigestion. These are the most common. Some people, they happen through the whole treatment. Some people, is at the beginning, the first few weeks of it, and then they get less and less and less. Or in some other people, is as they raise the doses, because what happens is that even the doses that you use to lose weight of this medication is a lot more than what you need when you're using it for diabetes. So what they do, the doctor do, is titrate, so that they type of to diminish as much the side effects. Instead of giving the big dose at once, they titrate it until you're taking the big dose. So sometimes some people, they get used to that one dose, and then when they titrate it to the higher dose, they get the symptoms again for a while, and then they get a little better, and then they get the symptoms back at the for a while. And some of them, the symptoms never go away. There's some people that they're vomiting every single day, no matter what. Okay, so those are the most common side effects. Now let's go to the next slide. And these are the most severe and the most frequent less frequent, I'm sorry. The most severe and less frequent side effect, but they're still happening in at least 5% of the people that take this medication, if not more. Okay, the first one is medullary thyroid cancer. They actually have, you know how cigarettes have the surgeon warning box in the boxes of cigarettes? they have a warning box in this medication that talk about medullary thyroid cancer. Okay, so that's one of the things that this medication can cause in the long run. It can also cause acute sudden kidney injury. Maybe you're taking a doses that your kidney can tolerate, cannot clear out of the body properly, and it damages your kidneys anyway. Even though that it was protecting your kidney by keeping you slim and by reducing your sugar and everything else, but if your kidneys cannot manage because you already have some kidney disease or you have a weaker kidney and it cannot deal with the amount of chemicals that have to be cleared by the liver and the kidneys, you can cause damage. You can get pancreatitis, which is inflammation of the pancreas. And inflammation in the pancreas is very, very painful. It requires hospitalization. Okay? Very painful. Then you can get gastroparesis. Gastroparesis, which the movement of food of the stomach is slow or stop. It's when the movement of the food in the stomach, it's not moving anymore and the food just stay there. And for people can even pass away out of this condition. But if you're feeling like you're not emptying to the bathroom, you're having severe constipation, you need to go to the doctor. If you're taking these medications and you are getting that. The other thing is bowel obstruction. It's like when the food is moving slow out of the stomach, down is out of the stomach, and it's in the intestine, and it's still not moving because this medication will slow the peristalsis. The peristalsis is the movement that the intestine do to move the food out, through the intestine, and then the intestine will be absorbing the nutrients and then go down into the colons to be feces and then get out. So when the food gets stuck somewhere, you need to be hospitalized. Many times they have to cut that part of your intestine, and then you might need a colostomy for the rest of your life because of that. Okay, so these are serious conditions that can happen. Okay, and then if you get an infection in that area, that can be even more serious. You can get sepsis, and you can really, pass away. Another thing that can do is also gallstones can attack give you gallstone and bile duct blockage. And then one of the ones that concern me the most for most people is the lean muscle loss and decrease of bone density. Okay. Out of the weight that you lose when you use a GLP-1 antagonist medication, out of the weight that you lose, 40% of that weight that you lose is muscle weight. Let me repeat that again. Out of the weight that you lose, 40% of the weight that you lose is muscle weight. So what happened with that? Muscle, especially if you're above 50, okay? Muscle is essential for your metabolism. So now let's say you stop the medication for some reason, or you have to stop it for some reason, okay? You're going to gain the weight back, but then all the weight that you're going to get back is fat. It's not muscle. You're not making up that muscle that you lose. Meaning that now your because muscle is what runs your metabolism. Now your metabolism is going to be slower. Not only that, because you have lower muscles, then you're going to have lower bone density. Menopausal women, we have to be concerned with low bone density because estrogen was something that we used to protect our bones, and now we're making a lot less of it because we're no longer menstruating. And then if we add a medication like this and we're losing muscle mass and losing muscle density, then we are at risk of osteoporosis, we are at risk of a fracture. Okay? And then one thing that give you a long prognosis, or what to say, that give you the security that you're going to have a long life, if how much muscle mass you have. The better muscle mass a person have and mobility, the longer they live. So when you're losing that muscle mass, you also, not only that, when you're losing the muscle mass, this is something, when you lose muscle mass, okay, and that muscle mass that you are losing and it's floating into the bloodstream until the liver had to clear it up and then throw it out where it needs to go. Okay, it also overexert the work of the liver, and when you have too much of it, it can cause liver failure as well. If the muscle mass is more than You suppose, and we are all individual. They said only 40% of what you lose is the muscle mass, but everybody is different. So when they decide to prescribe this medication on a person, I believe that it's not just I want it because I want to lose weight. I believe that they should do a better examination where they check your bone density, where they check your muscle mass. It's not so much. It should not too much concern about the weight, the number in the weight, the whole weight. It's more about the composition of your body. Because now, you know, some of the people that losing the weight, now they lost the weight, but they probably have more fat than muscle in ratio because of all the muscle mass that they are losing. You understand? So that's something that you have to be concerned. And then, like I said, I put here a list of the people that should not receive or should not be taking this medication. And it's the people that have type 1 diabetes, the people that are pregnant or breastfeeding, or if you want to become pregnant. If you're a woman that decided, okay, this year I'm going to get pregnant, and I want to lose weight, and you decided no matter what, I'm not going to listen to anything I hear, I'm going to take this medication anyway because I want to lose weight right away, and then I go, but then make sure that you're using birth control or doing something in the meantime, so you take it the time that you want to lose the weight. When you lose the weight and you get out, and the medication get out of your system, then you start trying to get pregnant. Because when you get pregnant while you're taking that medication, that can bring developmental damages into the fetus. Okay. It also is if you suffer of severe gastrointestinal disease or any IBS disease or inflammatory bowel disease like Crohn's disease or diverticulitis or ulcerative colitis, you don't want to be taking these medications. If you have what is called diabetic gastroparesis, that you already have a slow digestion because of diabetes, you don't want to be taking this type of medication. If you already have history on pancreatitis, you don't want to take this medication. If you have history of medullary cancer or any type of glandular cancer, meaning history of breast cancer, history of thyroid cancer, history of ovarian cancer, history of pancreatic cancer. When I mean history, is you or your mama or your sister or your grandma has it, you should not be taking this type of medications as well. Okay, it's very important that you know this. So now, as you put in a balance, you know all the things that I tell you that are really good about this medication, and now I'm telling you the side effect and the severe side effect. You gotta start putting a balance. Will I do this? Will I don't do this? You know. Okay, so what are other risks and complications that you can have? Another risk that you can have with this medication is allergic and anaphylactic reaction. Who knows? You might be allergic to a component of the medication that will give you an anaphylactic reaction. An anaphylactic reaction is that when you swell and stop breathing and your throat get like swell and you cannot breathe anymore. Those are anaphylactic reaction. That can happen with this medication. You never know. Something new the first time you take it, you never know if you're allergic to that, any ingredient on that medication. Like I was mentioning before, if you use it during pregnancy, it will give you developmental abnormalities in your baby. Another thing it is, remember these medications were first created for diabetics. So if you're taking that medication and you're already taking diabetic medications like metformin, glipizide, insulin, and all the things like that, then you need to monitor your sugar even more because it can lower your sugar. It can put you in a hypoglycemic incident. And you know that people can pass away from a hypoglycemic incident. So it's very, very important that you check your sugar. If you're taking this type of medication, you already take all the diabetic medication, you need to check your sugar. Fasting in the morning when you wake up, then 2 hours after breakfast, 2 hours after lunch, and just before you go to bed. And anyway, anybody that's doing any changes to try to lower their sugar or taking new medication or doing any changes in the diet regarding the sugar, they should take the sugar at least 4 times a day. Okay. Another thing that can do is that damage your metabolism. I already tell you that. And not only damage your metabolism because of what I was telling you before, because of the muscle loss that will damage your metabolism, but also it suppresses the ability to secrete the GLP-1 on its own. Meaning that the day that you stop it, okay, you are not going to be able to secrete your own GLP-1. Why? Because you were giving constant GLP-1 to the body, that the cells that make the GLP-1 decided, I don't need to make them anymore because, I already get a whole bunch of it, so why? And now you're not taking it anymore, but now that cell got lazy and it's not making it anymore. So that's going to even, help you gain all the way back anyway. So rapid weight loss can cause more sagging of the skin and wrinkles. They even have what they call the Ozempic face, because the people that lose the weight right away with Ozempic, their face kind of sink in. So they have that. And then also risk of malnutrition and dehydration. Why? Because now you have this medication you're taking in, and it's telling you not to eat, that you're full, so people won't eat. And because they won't eat, they won't eat. And then they eat whatever, because I'm going to be eating a little bit anyway. I'm not going to gain the weight. I can still eat all the garbage that I was eating before. Then they're going to suffer more and malnutrition, especially if they don't pick the right kind of foods. And they don't eat, as often that they're supposed to eat. They're going to be having malnutrition because they're not going to get enough of the healthy things that they need to get in order to get all the cells to work in the highest healing potential. So malnutrition, dehydration, and then not only that, improve and encourage bad eating habits. Because if people are doing this without a nutritionist beside it, or somebody that's guiding their lifestyle and their way of eating also, then people are not going to care what they eat, because they know anyway, if I try to eat chicken, I'm going to only take 2 bites. If I'm going to eat a hamburger, I'm only going to take 1 bite. If I'm going to have fries, I'm going to take two fries. Okay? So yes, they're not putting up the calories, but whatever they put in are empty calories that are bringing no nutrition whatsoever. So they're going to end up with all kinds of deficiencies. Okay? The other thing that can happen is depression and suicidal thoughts. They found studies where it's increasing depression, especially for those people that use foods as a calm substitution when they're eating emotional. There's some people, they have issues, they have children trauma, the childhood traumas, PSTD and all that kind of stuff, and they use food as comfort. So now they're going through something that triggers that trauma, okay? But when they want to eat something, they cannot eat it, because the mind is already comforted with the medication, not to eat, don't having the hunger, don't having the desire, cutting all the cravings and all that. So they won't be able to eat that. So what happened is that the root cause of why they were obese probably was because of all the emotional trauma that they were having through life, and they were using food as comfort. Not to mention that the fact that the food that we have available is crap, it's garbage. So all that together will make the person more depressed, and even can cause suicidal thoughts. What about the risk of overdosing? Because what happened now is that if you see the pens that I show in the first picture, they already come with the doses pre-measured. But the people that get the vial that they have to actually withdraw themselves, and usually that's the genetic semaglutide is called, that they might do the wrong thing. And then the people that they're anxious to lose weight, I don't have no symptoms now, and you can just put a little bit more. I mean, you might have no symptoms now, but you don't know what your cells are going through, and then they get a little bit more and a little bit more, and that can cause overdose and then more problems into their body, because they want to they lose the weight faster. And then interaction with other meds, because they cause lower the food mobilization from your stomach. The empty of the stomach is lower. Now the absorption of some medications is lower as well. Ones that you need to be very careful are birth control pills. Now when you're taking this type of medication, the GLP-1 antagonist, if you're on birth control, it lowers the effectiveness of your birth control pill. So make sure that if you really don't want to get pregnant, that you're doing other methods of birth control, because if you're taking the pill or you're taking anything that have to be hormonal and it's going to go through the digestive system to go into your body, it's not going to be able to work, so you can get pregnant. There's been such cases of pregnancy while in Ozempic. Okay? And then It's taken by patients that do not qualify just for pure vanity. Okay, there's people out there that are taking it just for the sake of I want to be skinny. I only have 10 more pounds. I'm just going to use this to lose it right away. These medications are not for people that only need to lose 10 pounds. They're not for people that are already slim. Okay, it's for people that have more than a 29 BMI. Okay, that you are actually obese. Okay, when you're actually obese, that's when you want to take. Or if you're not obese, you don't. Those people that I just want, the summer is coming, I just want to get into my bathing suit. Let me just take this. This is the wrong medication for you. Okay, the nowadays also is happening that a lot of girls. I've seen that things are happening, in social media. All these girls so skinny, and they all want it. They're already a size 6, which I think is that small because I'm double that size myself, and I feel good. And they still want to be size 1, and they're already skinny. So you're already skinny. That means that you have really less, unless you're working out and building up your muscle mass. You already have less muscle mass, and now you're going to be trying to take these medications. Then you're going to damage more of your muscle mass. When you damage your muscle mass, especially the teens, you're still in a growing spurt. You're going to be damaged also that current of your growing spurt. So that's another thing that you want to be careful about taking this medication. These medications are not for those. Another thing that is bad as well is for people that suffer of eating disorders. This is a very good excuse for people that have anorexia to start themselves, because really they won't even have the desire. Or the people that suffer of bulimia, they don't even have to vomit, and if that causes them to vomit, they'll be happy having that for the rest of their life, because they used to put their finger to vomit. So this is not a medication for people that suffer of eating disorders. There's another thing that you have to be extremely careful, okay, for when it comes to this type of medication. Another thing that this medication causes is that if you stop it, if you stop the medication, people, you're gonna gain all the way back. Okay, you're gonna gain all the way back. This is something that once you decide you're gonna do it forever. Now, the key that it will be good if people can do it, and then all these factors, all the risk factors that I say, and the ones that I said that they're rare, but that can happen in the long term, that they're sure to happen the longer you are in the medication. Okay, so if you decided to do this and you don't change your eating habits, you don't learn how to eat right, you don't learn how to eat the right food, the exercise, and do all the other stuff, this is the wrong thing for you to do, because it's going to cause all these things, and it's going to lower your metabolism, like I tell you before. And then when you get out of there, you're going to make less GLP, you're going to have less muscle mass, more fat, and when you gain back, you're going to gain it all in fat. So this is not a good thing. It's also cost. The price of this thing is, the Ozempic, if you don't have insurance or anything, it costs you $1,300. $1,300. If you have insurance, depending on what category they put it, if they put it in a stage 3, it can be anywhere from $99 to $400 or something a month. So imagine, this is supposed to be a forever thing, and then let's say they say you cannot pay for it anymore because you lose, life is life, like we say in the world, life is life, and you lose your job, or you no longer don't have the money, or remember if you get sick and you need to use the money for something else, and now you don't have the money for your medication, you're gonna get all that back. Another thing is that this medication is so common now that it goes in shortage pretty often. So you are taking your treatment, and then it goes in shortage, and you cannot get it, and here you go back gaining the weight. So that's another thing. Not to mention that another things that are happening now is that compound pharmacies, okay, are creating the genetic version of it. And when they're creating the genetic version of it, they have less control. There are less control that the manufacturer is when it comes to safety of the medication and what you put in and preservatives. They're less control than the actual brand name counterparts. Not to mention that a lot of the places that are making it are not making the right thing. And right now you can get it anywhere. You can there's things that come in social media that they just ask you questions. What is your BMI? What is this and what is that? The doctor doesn't even have to write a prescription because they already have a doctor in the clinic. So you just buy it, and then the when they receive the order, okay, write a prescription, doctor, so and so for this one, without checking your history, without checking your BMI, without checking your allergy, without checking anything, without even the doctor looking to you through Zoom or something and really see that you are overweight and really need the medication. So that's another thing that is happening. And then, of course, because they're making it generic, then cheaper, but it's still a good $250, anywhere from $100 to $250, depending on the dosage that you need. Okay? The dosage, like I was mentioned to you before, the dosage that is used for diabetes is a lot less than the one that I use for losing weight. So that means that increase the side effects. These medications have been used for diabetes, like Ozempic, for maybe 2-3 years already. So they have story of what can happen in the long run, but it doesn't compare what can happen now because the dosage that they use for diabetes was a lot less. Okay, and it also can increase in your blurred vision. So and increase, retinopathy and all other diabetes, eye disease. It will increase the problems with that when you're taking this medication. Okay. So now, won't you feel good if you knew that there was something out there that was completely natural, okay, that instead of you supplementing with a synthetic hormone, you activate your body to create that hormone that that God created to make, okay, and you're motivated to activate it, to create the hormone with things that are already nutrition. They're already adding nutrition into your body, already adding vitamins into your body, okay, that have a lot more benefits and have totally no side effects. Plus, because it's your own GLP-1, there's no muscle loss when you're losing the weight. Well, yes, they have created something like this, and it's called mind and body balance. Okay, and it has two parts. The first part is the GLP-1 activation blend. That's the 2 pills that will activate the GLP, and that is made out of lemon, berberine, honeysuckle, yerba mate, matcha, emplac, and chromium, all totally natural. Okay, and then to make sure that you have, because you're going to be eating less, and that you have enough fiber to stimulate the GLP-1, and that you have all the nutrition, and that your microbiome bacteria is balanced, you combine it with the second part of it that is called the mind and balance enhance. And that one has the resistant starch, it has fruit powers, it has kombucha, it has all these things will stimulate the GLP-1 production, and it also have probiotics, okay, and good medicines that help you with the health of your intestines, which are like ginger and licorice. So this is a natural thing, okay, that is coming up. It's going to be out in December. They already roll it out in this month, but it was because it was the first time that when they put it out after all the studies and everything, it was sold out within a week. Okay, so if you all interested, the next batch is going to come in December. So if anybody's interested of doing the natural one, and I know I had clients that have passed from the medication to take the natural one and have lost their weight and everything. So if you are interested, just write in the comments that you want to hear more about this. I want more information about the natural GLP-1. Just write that. I want more information about the GLP-1, about the natural GLP-1, and I will contact you and give you all the information that you need. So I hope this information help you to make the decision, okay, whether you want to take that medication or not. And believe me, there are in circumstances where that medication will be something that probably prescribed to somebody that maybe weigh 400 something pounds, that already have diabetes and other diseases, and I will prescribe it under the authority and evaluation of a doctor that is checking them weekly to make sure that the stomach is working fine, that controlling all the symptoms, and combine it with nutrition classes and cooking classes and eating classes and all the supplements that they need to make sure that they get all the vitamins that they be missing and stuff like that. And then just temporarily until they reach to the weight loss that they want to reach, and then continue with the lifestyle. That's the way I will use it if I have to use it in an extreme situation. Because like I told you before, I will never use it for nobody above 50. And I will not use it for children as well. Because if it's a thing that they have to take in the lifestyle, in the period of life, and it can do all that damage, they start younger, they're going to start experiencing the damage younger. Okay? And we don't want that. So I hope you like this information. And thank you so much for being here. And see you next time.